Hi, everyone. Rochelle here and Dr. Dana Philisaint welcoming everyone back to another episode of MindCare. So we are continuing our Trauma at Home series. And so today's topic is how to overcome the trauma you experienced after foster care. Now, this podcast aims to provide hope and answers and take away the stigmas of childhood traumas. Dr. Dana Philisaint is a professional counselor whose focus is on childhood traumas. Hi, Dr. Dana Philisaint.
Hello, and welcome to another podcast.
Yeah, so today is really an exciting actual topic. So how to overcome the trauma you experienced after foster care. So Dr. Dana Philisaint, why is discussing this topic so important?
Yeah, so there's a lot of individuals in our communities, in our schools, in our churches who sadly have gone through the foster care system, and some have experienced some unimaginable traumatic experience. And I don't think we talk about these enough, right? And so the aim today, I think, is to just bring awareness to those who don't know what's going on, and also to bring about hope for those who have gone through the system for whatever reason, and help them to overcome some years of pain and anguish. You know, in addition to that, too, there are foster care parents who may be interested in this topic and might be able to find some information to help those who they're trying to help in their homes. So, you know, children are placed into foster care for trauma, for various things, and these things need to be addressed, you know. So we need to bring about this awareness. That's why I feel that it's important for us to discuss this topic.
So what are some of the common symptoms of trauma that are often recognized among children who are in foster care?
Okay, well, you know, there are situations that bring people to the place where they have to be in foster care. And so there are some symptoms that we can be aware of that they might experience as a result of being pulled from their home and being placed somewhere else. Things like reattachment or attachment issues, or being able to trust people. They might have a hard time trusting people. Sleeping issues, they might have appetite, loss of their appetite, even some younger children, toiletry issue or toileting issues, inappropriate boundaries they might have issues with. Sometimes they have a hard time sleeping at night because of nightmares and night terrors, flashbacks from various things that might have happened to them. Hyper-arousal. Some of them might be very active and, you know, don't know what to do with all this energy that they have. Food hoarding might be another issue. Let's say they neglect of some sort. And another very common one is tantrums. Kids throwing tantrums, and they don't know how to go about expressing what's going on, and so they throw tantrums. So these are some common ones, and there are other ones, of course, but those are the common ones that we know of that children that have gone through the foster care system or in the foster care system might exhibit as a result of being placed in foster care.
Okay, so I know this is a very general question, but so what are the situations that can cause children to have to go through the foster care system?
That is a very generous question, but, you know, just keep in mind there are tens and thousands of children who are placed in foster care, and it's usually because they've been removed from their home due to extreme abuse cases. You know, child abuse is a major problem globally. We know that. But even here in the U.S., you know, there are child protective laws to help children stay safe and be safe, but child abuse is still a very big problem. So child abuse and maltreatment, they usually are grouped into 4 categories, like physical abuse, sexual abuse, emotional abuse, or even neglect. So these are the main reasons. Most of the time children are being removed from their biological home. So for these children, even the transition into foster care is traumatic. You know, so they're dealing with loss, dealing with trauma, they're dealing with grief and separation issues where they're being pulled away from their siblings and being separated from those individuals that they know. And so, you know, emotional trauma might be another result of being pulled away from people that they know and love and so forth. So.
Oh, wow. Okay, so before we delve into the actual child abuse, I wanted to ask a couple more questions about the actual foster care system. So, like, on average, how many children can go through the foster care system, like, you know, annually?
Okay, so according to the National Foster Youth Institute, there are about 8% of the total children or child population in the United States that are reportedly pulled away from their home by authorities annually.
Oh, wow.
So the U.S. Department of Health and Human Services estimate, I think in the 2019, they estimated that over 251,000 children have entered the foster care system that year. So in total, there are over 400,000 children in the foster care system, over 400,000 in the foster care system in a given year. So that's the situation, and that's the sad reality of a lot of children right now. And, with these children as well, there's research that shows that trauma is not just extremely common, but it causes even chronic problems throughout their lifespan. So these children are going through a lot of things, and it's quite a startling number as well.
Okay, now for our listeners, are there any statistics that we should know about?
Okay. Well, if you want to get more specific in terms of numbers, 2019, I would say, over 672,000 children have actually gone through that system. We mentioned that any given year you had about 400,000, but through the course of that year, a lot of children have gone through that system, and it is said that children remain in the state care for over average about a year and a half, and about 18% or so, or 20%, will be in that system for until they age out. So let's see, they say 23,000 children will be aged out every year, and then there is also numbers that shows there's less than 3% chances, I should say, for those children who age out of the system going through and entering college. So 3% only are going in. So that's a very, very small number, right?
Oh,
and then about 20% will never be reunited with their family, permanent home, or have a permanent home. And so you have issues where they said that 7 out of 10 girls who go through that system by the age of 21 will have, gotten pregnant. So that whole cycle eventually starts all over again. So research is also showing that as a result of all of this, they're highly likely to experience, homelessness, unemployment, or even incarceration as adults. So, as individuals and churches and family and community and schools, we need to be aware of these statistics so that we can know how to support these individuals.
Wow. Okay, so you talked about some traumatic events earlier. Do you have any research on how these traumatic events have impacted, the mental health of children, in foster care?
Yeah, there's tons of research that's been done, and there was an assessment that was actually done comparing those who've gone through the foster care system and those who were in the general population. They took a study that was done in, I think it was 2004. There was a study that was done. They looked at 1,087 students or children who've gone through the foster care system, youth in general, between the ages of 18 and 22, and they took a number from the general population just to compare. They saw that those who went through that system whereas 15% of them experienced major depression, the general population is 10%. Right? So social phobia, 11% or 12%, the general population 8%. Panic disorder, 12%, the general population 3%. Anxiety issues, 9%, general population 5%. Even alcohol abuse, 3 to 4%, general population 2%. Even bulimia, eating disorder, the foster care system, 3%. And the general population is 0.4. So you can see that they experience mental health issues on a much higher percentage than those who never went through that system in general. And then there's things like toxic stress that we talked about before that they experience on a much higher level, and so there's physical problems that are more likely for them to experience than those in the general population, things like diabetes and anxiety, depression, of course we talked about, but obesity and even cardiovascular diseases as well. So as a result of all the things that they experience. So there's some of those things to consider and keep in mind as well.
Okay, so I know one of the things that we always talk about on this podcast is providing hope for people, providing hope. So my next question is, if, for those of our listeners who are listening, if you are a foster parent, what can you do to help children who were or are in the foster care system? How can you help them as best as you can?
Okay. So something to keep in mind is that the American Academy of Pediatrics, they mentioned that one of the greatest needs that the foster care system needs more than anything is individuals to help these kids, adults, or even children, if they're in the system, with mental health healing. So think of these 7 strategies as ways that you can do if you are a foster care parent. So number 1, follow the case manager's plan. They usually have things like make sure you take them and see their counselors and so forth, right, in their plan, if that's something that's necessary. Number 2, I would say, is show compassion and empathy. Learn how to do that. Don't go into helping in foster care for, I'll just say it, money's sake, because it's not even worth that. These kids need to feel your love and care and support, so show them compassion, show them empathy. Number 3, I would say, is create opportunities for them to share about their fears and concern and share their stories. So find time for them to share so that you can listen, because they need listening ears. 4, I would say give them one-on-one support and time. Take them to places so they can learn and see life in a different way. And number, I would say 5, is teach them stories about being resilient. We talked about resiliency in another podcast, so listen to that if you need to learn more about that. But teach them what it means to be resilient. 6 is let them be kids. If they're children, take them outside in the fresh air, help them to, explore in nature, and let them be children, because they are children. And then 7, pray for them and with them. So important that they, develop that hope in something, in someone greater than themselves. So that's the 7 things I would say for a foster care parent that they can, implement in home, and things that they can do to help that children or their children that's going through the foster care.
Yeah, those are some great points. I like that. Let them be kids and provide some hope. So definitely some fantastic points, Dr. Dana Philisaint. And this is my final question. For our listeners who are listening, this question may or may not apply to you. But if you went through the foster care system, what can you do to overcome the trauma you experienced? Dr. Dana, do you have any points for people who have been through the foster care system and they might need some help overcoming what they've gone through, what they've experienced?
Wow, that's a deep question. A very needed to be answered, of course, too. Let me give you seven points to consider, to remember as well. 1, acknowledge that you are a survivor. While you may not have gotten the best upbringing, you missed out on certain childhood experiences, but by God's grace, you are standing and you have successfully crossed over into adulthood. So you are a survivor, just on a mere, things that could have happened, but you are here. So that's number 1. So acknowledge that. Acknowledge you're a survivor. Number 2, I would say, now that you're an adult, you now have choices. Know that you have choices and make the best. Select the best choices for your life, whether it be in the careers that you're choosing, whether it be in spouse, whether it be in practices, whether it be in things that people might try to pull you to and for, whatever. But try to break negative cycles in your life and select the best for yourself. So now that you're an adult, make the best selection. Make the best choices. Number 3, I would say, is address those issues. Address the hurts that you have, if you still have these things that are lingering in your mind. Find your voice and then learn the various tools of how to go about addressing trauma. We've talked about so many things when it comes to trauma You can go back and listen to some of those podcasts that we have, or even, call us, and we'll help you with the tools to go about learning ways to address your trauma. So address the hurt. Find your voice. That's number 3. Number 4, I would say, is to identify the person that you forgive and learn how to forgive. Ultimately, as we discussed before, forgiveness is really about helping you. And so find those individuals that's holding you captive in your mind so that you can be free. So that's number 4. Number 5, which is so very important, is to create stability, learn how to create stability in your own family right now. There's no perfect family. We know that. However, find time to learn to observe good family models and practices. Go to church, find church family members, and be part of something that's bigger than you. Be part of a community of people that can teach you what it means to be a family. A lot of times people don't know what it means to be a family because they've had such a negative view of experiences in life. So, find ways that you can teach yourself. Learn about the family of God. Learn about, see from practical individuals that have good family structure, and then model that as well. Number 6 is to, map out God's purpose for your life. Pray and ask Him for wisdom. He'll teach you exactly where you need to be, how you can use that traumatic experience to find your mission and so forth. Find out what you are about, because there is a purpose for your life. So, and lastly, I would say which is another important point, there are so many other children out there, as we mentioned, that are going through the foster care system, that are in the foster care system, and ways that you can reach out to help. As you've experienced and you know what it means to have gone through these experiences that they are going through, maybe you can be part of the Boys and Girls Club. Maybe you can, find in your heart to even be a foster parent, if that's something that you can afford or do, or find the time to do, or just be a voice to someone and sharing your experiences. Those things, you can help out those children. There are children right now who are yearning for that support. So find it within your heart to go out and give back and do it the right way so that they too can benefit. So those are 7 very important steps and doable steps that you can take to help out as well.
Yeah, that was pretty good. Acknowledge that you are a survivor. Dr. Dana Phillips sent some really good points. And for our listeners, if you have to go back and listen to this podcast again and, make sure you get those points, definitely do that. And Dr. Dana Phillips, do you have any final thoughts before we close out today's podcast?
I think that is the final thought. The final thought is that you're a survivor and God has a plan, and He wants to reveal those plans to you. And don't give up. Don't give up. You cannot give up. Deal with the hurt, and be that person that you wish someone was for you when you were a child. So.
And for our listeners, don't forget to visit mindcare.us for resources and additional information. And if you know somebody who's going through these issues, definitely, have them listen to this podcast or reach out for help, definitely. And don't forget to like and subscribe. See you guys on the next episode. Bye-bye.